Good morning everyone, I am Dr. Mini Mathew. I work as the head of the Department of Obstetrics and Gynaecology at Aster Hospital Mankhool. At this time of pandemic, we all are concerned about visiting hospitals thinking that there is a higher chance of contracting COVID infection at the hospital settings, and we do miss a lot of essential appointments. Especially during pregnancy, your antenatal checkups are very important as far as a safe delivery is concerned. Here at Aster Hospital, we strive to keep the hospital transmission of COVID infection as minimum as we can. The Infection Control Department has implemented strict infection control and prevention policies at every point. Our staff are vaccinated and are well trained. If any of the staff shows any symptoms suggestive of COVID, or they have a history of contact with a COVID infected person, then they are tested for COVID infection and are quarantined. As far as the patients are concerned, at each and every entry point, there is temperature screening going on, and those who have fever are guided to the designated fever clinics with restricted access. As you enter the waiting area, safe distancing is ensured, and the common areas are sanitized at regular intervals. Hand sanitizers are kept at every touch point. Proper wearing of mask is ensured for everyone, and there are videos and posters around reminding you of COVID sanitization policies. At the assessment station, you are asked about history of any contact with any COVID infected person, and also you are asked about the symptoms suggestive of COVID infection and triaged accordingly. At the doctor's office also, safe distance is maintained at all times except during examination. And if the patient can communicate well, only the patient is allowed to the doctor's office, and the changing of linen and proper cleaning of equipment, all these are ensured after every patient. And at the time of admission in the wards, if you do not have COVID and if you are asymptomatic, even then all the staff are following strict infection control policies. And in the labor room, only one person is allowed with the patient and visitors are not allowed. And the relative who is staying with the patient is asked to wear a mask at all times. And if there are patients who are COVID positive, they are treated in COVID and designated areas which are separate for COVID infected patients. And in the wards also, we do follow strict infection control policies, and visitors are again restricted there. So, here at Aster Hospital, we are quite equipped to keep the hospital transmission of COVID infection at bay, and you do not have to worry unnecessarily about getting COVID infection at our hospital settings. Make sure that you do visit us at the essential visits, and we are here to treat you well. If you are posted for elective surgery, COVID PCR test is mandatory. And if you are undergoing any emergency surgery, we do take the COVID test and follow strict infection control policies. Thank you.